Welcome back to the channel. Have you ever considered how pervasive female bladder leakage actually is? We're discussing an issue that doesn't often come to the forefront of your considerations, yet it's crucial to address. In today's discussion, we're delving into the complexities of this often underestimated yet significant health issue that affects a large number of women across the globe. Female bladder leakage, or urinary incontinence as it is medically known, is a condition that strikes a vast majority of women at different phases of their lives. Notably, it's a common misconception that this issue solely concerns the elderly female population. However, this couldn't be further from the truth. On the contrary, women from various age groups, from young adults to middle-aged females, can and do experience symptoms. It's a widespread problem that transcends age boundaries, proving that it's not merely a senior issue, but a women's issue. It's time we shed light on the true scale of this condition. As it stands, an astonishing number of approximately 7 million people in the UK with this health issue. This number varies in severity, but it's clear that the issue resonates with a colossal number of women. To give you an idea of the scale, about 39.9% of women in the UK, based on a cross-sectional postal study of 1415 women, found to have a prevalence of urinary incontinence.
Now, when we talk about bladder leakage, it's important to understand that two key types exist: stress urinary incontinence and urge urinary incontinence. The first kind is experienced when there's leakage during physical activities, such as coughing or sneezing. The latter is distinguished by a sudden, powerful urge to urinate. The distinction between the two is crucial. Stress incontinence can happen when the muscles supporting the bladder are weakened, while urge incontinence is more about the bladder squeezing at the wrong time. Hormone called estrogen is hugely significant in this context. Analogous to how the Blue Ridge Mountains topography is shaped by its ridges and valleys, estrogen aids in thickening vaginal tissues, creating folds named rugae. Yet, when estrogen levels plunge due to age or menopause, these tissues grow thinner and drier. This hormonal shift can drastically affect bladder control, leading to the issues we're discussing. However, when estrogen levels drop due to age or conditions like menopause, these tissues become thinner and drier, which can significantly affect bladder control. Risk factors for bladder leakage include age, menopause, pregnancy, childbirth, obesity, smoking, and chronic conditions like asthma. However, it doesn't have to be a life sentence. There are many treatments and solutions available, each tailored to your individual needs and lifestyle. Non-surgical solutions are available, like pelvic floor muscle training, bladder discipline, and dietary adjustments. These often present a natural, minimally invasive first line of defense. If this isn't enough, surgery is an option. Slings and bulking agents are commonly used procedures. Additionally, the medical field is constantly evolving. New treatments are under investigation, such as regenerative medicine techniques like stem cell therapy. These futuristic treatments could potentially revolutionize the face of bladder leakage treatment. On the pharmaceutical side, there are medications that can provide relief. However, potential side effects need to be taken into account. For a more advanced approach, consider Botox injections or neuromodulation. These therapies aim to relax bladder muscles and regulate bladder function. Advanced therapies, like Botox injections and neuromodulation, are also available to relax bladder muscles and regulate bladder function, respectively. While bladder leakage is a high-prevalence issue, it's still considered a taboo topic. This stigma leads to many women enduring discomfort in silence, laboring under the false assumption that it's an unavoidable part of aging. It's vital we break down these walls of and encourage frank, open discourse. We must push for more women to seek medical counsel and support. Female bladder leakage isn't just a simple issue, it's a complex one that demands a holistic and comprehensive approach. And the approach isn't limited to lifestyle modifications and pelvic floor exercises. There are cutting-edge surgical options that can offer significant relief. The range of treatments is quite extensive, and it's crucial for women to realize they're not alone in this. Help is readily available. Medical consultation can drastically enhance their quality of life, leading to improved wellness and confidence. It's time we recognize that bladder leakage, while being common, is not a normal part of aging. In our journey towards understanding and addressing female bladder leakage, we've covered its prevalence, the role of estrogen, risk factors, and the importance of breaking the stigma. Now let's talk about empowering women with practical steps and self-care tips to manage this condition effectively. First, ensure you're drinking plenty of water. While it might seem counterintuitive, staying well hydrated can help control your bladder. Second, maintain a healthy weight. Excess weight can put pressure on your bladder, leading to leakage. Third, practice pelvic floor exercises. They can strengthen your muscles and help you regain control over your bladder. Next, try to identify and avoid food or drinks that may irritate your bladder. These could include caffeine, alcohol, and spicy foods. And remember, it's okay to use products designed to help manage bladder leakage, like pads or protective underwear. Also, don't forget the importance of regular checkups. Regular medical consultation can help monitor your condition and adjust treatments as necessary. Finally, seek emotional support. Whether it's joining a support group, sharing your experiences with friends, or seeking professional help, remember you are not alone. It's time for women to take back control, to live without the constant worry of bladder leakage. It's time to empower ourselves with knowledge, understanding, and self-care. And with that, we're wrapping up our discussion on female bladder leakage. We hope this video has been informative and inspiring. Thank you for listening. Please remember to like, share, and subscribe.